give a quick intro to Dr. Jafeth Sanchez. She is a 3-time graduate of UNR. She's an associate professor, and she's dedicated her career to developing high-quality educational leaders across P20 educational pathways. She is the director of the Latino Research Center at the university, and we are so honored to have her here. She does incredible work at the university and in the state. And so she will talk a little bit about her work, and thank you for being here, Dr. Sanchez.
Buenos dias, good morning. For those of you who don't know me, I'm Dr. Jafeth Sanchez, as was said. Thank you for that kind introduction. I wanted to ensure that we cover a little bit more about the Latino Research Center itself, because as I was telling Dr. Reno, so it's the only one in the entire state that has this focus, and I think that often is not shared enough because of the work that it can do in order to meet its potential. So once I cover the context, I will also then jump into one of the recent products, which is really the focus of this conversation, which is our efforts toward becoming an HSI. And then you can raise your hand and ask me questions as we go through it. It's completely fine, but I'm still eyeing the time. I know I have about an hour, so I will keep track of that. Our Latino Research Center, the vision for me in becoming part of this entity is for the ability to ensure that our research leads to social cultural impacts in our communities and beyond. Previously and contextually, the structure is really important because it used to be tied to where the person would serve 3-year terms. The Latino Research Center started out of the College of Liberal Arts, so all the things that it did were also tied to cultural traditional aspects, which when you think of things like Dia de los Muertos, they initiated that on campus, and so the events were more the things that people often attribute to the Latino Research Center. But I put my name in the hat to become the director in spring of 2022 when the last director left our institution. And at that time, my question kept being, it's called the Latino Research Center. Where is the research? And it's no effort or anything bad on the previous people. This is why I mentioned structure matters. The College of Liberal Arts did design it to help ensure that it focused on the traditional cultural things. So the previous directors had almost all been part of the College of Liberal Arts, and then their own time to it was only 20% of their role. So when I started in spring of 2022, they said, great, you don't have to teach one research class and you can go be the director. And I did that for an entire year without other faculty, with one course off and 20% of my time. And everybody says, you were doing 200%. I was there every single day and still doing everything that I have in my original role, which is to serve as an associate professor in the College of Education and Human Development. But thankfully, due to our president, Brian Sandoval, we have our executive vice president and provost, Jeffrey Thompson, and our person who leads and oversees all the government and community engagement, VP Michael Flores. When they learned more about this, they said, why is that happening? Why is the person only doing this 20% of the time? Why are they under the College of Liberal Arts? Lots of great questions that I just kept saying, oh my gosh, they get it. And so fast forward a little bit further, the following fall of 2023, they moved the Latino Research Center structurally out of the College of Liberal Arts to be under the Office of the Provost. So that right there gave the center a lot of autonomy to do what it needed to do. So I no longer was in the position of going to a dean and saying, can I apply for this? Or are you okay with blah, blah, blah? Huge step. But it didn't change my role. I was still doing 20% only to the Latino Research Center. So it wasn't until January of 2024 that my function also changed. So my contract became 20% to the college and 80% to the Latino Research Center. And people say, well, that's the same thing. You just flipped your percentages. I'm like, no, it isn't, because I let go of almost all the classes that I was teaching as a professor. They removed all my committees, which we all know if you're a professor, you do national, international, local, state, college, department. It just goes into every single detail of that effort. So all of those came off my plate. I was also the program coordinator for our educational leadership program, which is where my area of expertise is. And I let go of all that coordination. So no more scheduling, who's doing what classes, who are we hiring outside of our program, all of that left. So literally the 80-20 flip did make a huge difference. And now it's where, to me, I feel like as of January 2024, I was able to leap into really doing the work that I envisioned for the Latino Research Center. Its mission has remained unchanged. It really is centered on ensuring that our Latino community and our university are connected, but that happens through 4 areas: through research collaborations, the opportunity for student achievement, and advocacy and outreach. So when I'm thinking about the work that the Latino Research Center does, I'm focusing on these 4 areas, but within that, because my emphasis is truly on research, I created 4 buckets, and those 4 buckets help to me, they help me be able to really center in on, is this tying back to the mission, and is it within one of these buckets? Because a lot of people ask the Latino Research Center for help, and I have to, have a way to really ensure that it's still working toward that end goal. The 4 buckets are tied to areas for education, aspects for the economy, health, public health, and civic engagement and immigration. So when somebody comes to me with something of, can we partner on blah, 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 I think about where does it fall within those 4 buckets, and where does the Latino Research Center need to amplify its work within one of those buckets. We do have some research and grants happening, which is really exciting. The biggest grant that we have is the Community of Bilingual English-Spanish Speakers. I shared that with some of you, particularly if you're students. It is a pathway program. We identify 30 Latino students. They have to be bilingual, they have to be interested in STEM and health, and they're in their junior year of high school. And then we get 7 from the university who are already in one of these pathways, and they serve as mentors for those students. The 30 high school students come to campus in the summer. They engage in this entire week-long experience with topics of STEM and health, with speakers, professionals, activities, and fun. They still have fun. And then for 2 more weeks, they extend that programming, and they end up working on a research project that has an outreach intention. So they're able to now identify a need. Their end goal is that they're going to actually go to the community and share this information. And then now they've become mini researchers. So it's a nice tagging into not being afraid of that word research from a very early setting and continuing that pathway into higher education. This grant is only 1 of 12 in the entire country. So it's also really exciting in being able to have Nevada be part of that hub. And in this grant, one of the primary areas is on focusing on linguistic and geographic diversity. So the geographic part means we're only recruiting out of rural Nevada. Just a nice little kind of plug in there for that. I did just submit a grant October 8th, so I survived an NSF grant for $5 million, and that one is also STEM related. It's a partnership with the Gwynn Center, so they would take on the lead on policy priorities. Sierra Nevada Journeys, which focuses on outdoor STEM programming. With Tiffany Young, her focus is on consulting for diversity and equity. And then with Manny Becerra, who is one of the Nevada's experts on AI. So that one, if awarded, if it doesn't get awarded, I'm gonna look at every single detail. We're gonna submit it again next year. It does have already on the calendar for next October 15th. But the focus on that one is to identify how or whether AI can be used to create more culturally responsive curriculum in STEM. So SNJ Sierra Nevada Journeys already does all this programming. Can we train AI to revise the content and then implement it? So you can think about how much that would allow us to scale up if we do identify that it's possible to have the system do that through a culturally responsive lens, to eliminate a lot of the biases we know exist in the systems, and then be able to disseminate that into other settings beyond that hub of Sierra Nevada Journeys. So that's essentially what that one is. And then we have other ones. We didn't fully let go of the events pieces. We actually have Dia de los Muertos coming up next month, but the university did add another position 2 years ago, which is Director of Latinx Hispanic Community Relations. And that has helped have a connection to the event still, doing what they need to do, but not necessarily being completely led by the Latino Research Center. So in this case, yes, Latino Research Center still wrote the grant that usually helps carry out a lot of the key priorities for that. but Director Osvaldo Jimenez Estupiñan, who is now leading that effort, he's carrying out that piece. So just helping to distinguish a little bit more of where the LRC has now had that opportunity to really hone in on research and not have all these other things that are taking place in there, even if as a partner. I'm also really committed to ensuring that we have fact sheets. So people would ask me, how many Latinos are in Nevada? You know, and I'm like, great question. That's nowhere on our website or anything like that. So we still don't have a marketing person. It takes a lot longer for things to get up on our website, but we're committed to making sure that we have access to that information for anybody. My dream would be to have the ability to query all the research studies through the Nevada Department of Education, through our organizational institutions for entry, and have it be a hub where if you do want to know something like that, you can click and say, oh, I know that Doctora Fernandez is working on a study of blah, blah, blah. Oh, I know that Dr. Cucaron Calderon has a study right now that has to do with, you know, smoking and prevention and vaping. So they would be able to narrow in on that information rather than just only asking word of mouth or looking at databases. And it emphasizes our experts across Nevada as well. I haven't quite gotten there. I'm asking the questions about those queries, but they're not at that point. Currently, some of our fact sheets are tied to Nevada's Latinas in the workforce, AI and the impacts of Latino communities. We have some on mental health, doctoral pathways, and then we do have just a simple one sheet that is about explaining what HSIs are, where we're headed in terms of the university's focus, and then what that means for continuation. And that one is in Spanish intentionally. Again, that one hasn't made it to our website, but we just kicked that effort off. So you'll see more of these in other areas. The mental health vulnerability one, that is, I believe, on our website. And an important part to that is that this doesn't have to be created by the Latino Research Center. It's highlighting others' areas of expertise. We do put a little note back to where whatever the citation is or the original area of research for that person. And it's just a way to help ensure that it can be disseminated because we do have a wide audience through the Latino Research Center. Other research and grants, not everything is funded because as you may know, I'm the one person, I have a program coordinator, I have a administrative assistant, and then I have some more peeps through that CBES grant, but that's about it. I always compare this, if you're familiar with the Gwynn Center for Policy Priorities, we have the executive director there, and then she has like 8 other people, with a person who just leads education, the person who just oversees the economy, the person who does operations, the person who does advancement. I'm all of that person in one. And so that's another way to also advocate for ensuring that entities like ours do get support in terms of allowing for its potential to really be met for our state and beyond. So all of these that are non-funded are still really tying into those different categories that I mentioned for the 4 buckets. But the Men of Color one is one with TMCC where they focus on identifying students in their junior year, support them for 2 years with the aims of ensuring that they enter Truckee Meadows Community College. And after some conversations there, they said, you know, we have about a 30% enrollment rate, and we don't know what's going on. We spent 2 years with them, and yet they're not entering. And this is why we're doing this program. And so we're looking at supporting their evaluation side and really identifying what it is or what is happening or what is creating that reason for their lack of actual full enrollment and then completion, of course. The Latinx faculty research needs, it is much too often that as a faculty member, we mentioned retention, right? That retention piece is also really important in higher education for those who come from this underrepresented background. I usually put it quite simply as a Latina in higher education. My work, if I publish something, the next question right before it's about to go publish or be published is, would you like to make this an open access article? I clicked yes, and then it says, great, your fee is $3,300. I'm like, where do I have $3,300 from? We have $200 for travel. That's College of Education. I'm sorry, College of Education, human development people out there. But the one thing then is, by default of the field that I'm in that is already underfunded, by default of lower access to those resources, my work is going to be much less likely to be seen at a wide level, either global, because now it's already hidden behind a paywall, in comparison to the person who has access to say yes, to pay that fee and then get their work out. It's not to say that one is more important than the other. It now just tied back to, again, a lack of resources within a specific field. And so that research is really aimed at this, getting at some of that, but even more so than, does every faculty member think that's one of the key areas of ensuring that they have a wider reach, or that they have more access to ensuring that they're being retained within the institution. So we're hoping to look at that even more. And it also stems from at the University of Nevada in particular, that we have seen more faculty departing who have this identity as Latino Hispanic. And part of that has been in conversations with others. They say, oh, well, they're pursuing other avenues, they're moving up the ladder. And then we're having conversations in our group saying, that wasn't the case. This person left and now they're not in a tenured position, and they were willing to leave to be in a non-tenured position. So what was happening? How can we get that out? But all of that is something where I want to ensure that it's, non-biased. So we really need to have the ability to cover this information from the lens of the faculty and really see what's happening in that experience. And that's part of the aims toward becoming a Hispanic serving institution, which again, I'm going to dive into a little bit more. But it goes on down to the more recent part that I'll cover here is our report toward becoming a Hispanic serving institution. And then historically, since the Latino Research Center was founded, which was in 2004, believe it or not, we are in our 20-year anniversary. And a lot of people are like, oh, I thought you were new. I thought you just started. I thought this happened. I'm like, no, it's been in existence for 20 years. But again, when we talk about that being underfunded, underserved, the entity itself has experienced that. So in 2006, the organization launched a Borderlines journal, which is an academic journal, but it has always been in print version. So this last issue that got printed, it's the first time that we put it online. So if you actually go to the university's ScholarWorks or Scholar Wolf, now every author who is published in Borderlines will have public access, online access, open access. So that's something that I'm really proud of being able to do for our faculty across the country. And our first release that was our first COFA release, it has a 4-year effort. There's special issues all designed around this HSI designation. So the current one was centered on emerging HSI aspects. The next one is going to focus on students at HSIs. The next one is going to be on the faculty. And then the final one is going to be the full picture of what is servingness at an HSI. So we're going to have a series of this 4-sequence series that we will be covered over the next 4 years. So really integrating all the work that the LRC is designed to do, not only within the local area, within the state, but really from this national scope and level. So I'm going to pause there just in case anybody has questions. I'm a fast speaker, but I used to be a high school teacher, so pause, wait time is super easy for me. Yes, Doctor.
So my main question is, I'm seeing the Latinx faculty research needs as part of the things that you're hoping to be able to support and also lead to increased retention. The question is, how does that look? And then how would that look? How would that view change based on the different needs for different schools?
Yes, great question. So he was saying, how does that look if we do have Latinx faculty research needs? I'm seeing it, but because I want to make sure it's unbiased, and I really do want it to come from what the faculty share. And this is not just intended to be, at the university level, but beyond that. The things that I've seen so far, just anecdotally from the people who reach out, is some don't even know how to do an IRB submission, which is wild to me. I'm like, well, we have to do it through our own dissertation process. But when it comes to another study, just understanding those ethical differences of what to complete and what not to complete, it makes a big difference. So already I meet with some and I just help them through the whole process, either just through the document area or actually being a co-PI for them. So I have at least, I think, 4 different collaborations where I'm a co-PI because I helped with that process. And then ultimately the research center will help with dissemination or recruitment of their participants. So that's a big one. That's a very simple one that I see even just an issue beyond the demographic, that there should be a way to have a better understanding of what entails IRB submission beyond doing a city training or ethics training for that. That's a simple one. The other one is the inequities that I'm seeing with what the startup funds are or research opportunities. So as a faculty member, it's really important for an R1 institution to build and generate that prestige. But if I don't have any money, I said $200 to travel, that doesn't even pay for registration. We know how that works. So if I can't get the research out into larger areas, then again, that's hindering the opportunity to build prestige within the person and within the institution that is really valued toward tenure, promotion, full, right? So that's another thing that I think really hinders that inability, where there's not equity into how much somebody is getting as a faculty member to do that work by college. So that's definitely by a college thing. The other one that's also inequitable across colleges is the teaching load. So throughout my entire pathway toward tenure track, I had a 3-2 teaching load. 3 classes the first semester, 2 classes the next semester, 5 graduate classes total. I was walking from a different committee a couple years ago with another colleague in engineering, and he said, "Oh, it's a tough semester. I have a 1-1 load." I'm like, what do you mean 1-1 load? Yeah, I taught 1 class last year and I'm teaching another one this year. And I was like, what? You have a 1-1 load? That's amazing. I didn't know that was a thing. And then generally, when you compare an R1 institution across other R1 comparable institutions, they have a 2-2 teaching load. So I think the teaching loads are a big difference, where in the College of Education specifically, they have a heavier teaching load than others, which we know does impact the time to publish and get information out and focus on that. But the standards on getting tenure still remain the same. You know, that's not really considered in the process. So already I was put another barrier toward being retained, and I'm experiencing that on the pathway toward full, which I think is a really important thing to be mindful of. And some people say, oh, I didn't even realize like that existed. I thought everybody did the same thing. And so advocating, that's something that I do see on the advocacy and outreach side, really important on making sure people do see those distinctions. So last year, the legislature, when they were requesting more support for faculty and the COLA increases and all of that, and we mentioned that, they were like, nobody's ever talked about that to us. You know, I think that's really important. Yes.
You kind of touched on it already. I was just going to ask, like, what are you doing, and what is the vision for this next, I guess, year, 2 years into the next legislative session to kind of make changes in this regard?
Yeah, I mean, a big piece is to ensure that the Latino Research Center is well funded from the state perspective. They have done a lot of things, like I mentioned, structurally, even for the roles. There's been increases within the salary positions and things like that for those who are part of the Latino Research Center. But in operations, I really do only have $5,000 for the entire academic year. I hired a new program coordinator and they need a new computer. It's gonna end next October. And this is not to complain at all, but it's really the reality of the research center, where I'm thinking, wait, but if I have to get a new computer, I'm already down to like $3,500 plus a business card. I'm down another $500. How much do I have to actually do something? And that's why research and grants really are important for this center. But also, given that it's really functioning as a statewide organization, I do see that the legislature can be a big piece of changing that. And I always mention, you know, this is beyond me. This is for the functioning of something that can really do great things in the state and elsewhere. The faculty collaborations to me are really important, especially if I'm only one person. I'm not the expert in public health. I'm not the expert in immigration. I am the expert to a degree in education, but I also have come into this role being very mindful that everything that comes out of the research center is not going to be education, because that's default what I do. It needs to cover the scope of the work that we see ties to the issues of the Latino Hispanic community, our Latinx students, our campus, those who really have the need for voice, and that can only occur through partnerships. So this isn't an exhaustive list, but we do have a touch and reach across the state across the region and across the country. Our biggest reach across the country is that there is an organization, this one at the bottom, Inter-University Programs for Latino Research. It's 25 institutions who also have a type of research center like ours. Some of theirs are still more under the College of Liberal Arts and culturally affiliated and tied to the events aspect or the programs aspect, but a lot of them are still research centered. And last year, some of those organizations started reaching out to me or others who are not in that program and said, I'm trying to create one. And one was in Colorado. I'm trying to create one in here. Can you tell me what you've done and how you've gotten funding? I was like, oh, funding, I'll tell you about that. So, but it's been really important to show that despite that, the Latino Research Center can still thrive. So imagine what it did if we had a lot of people and a lot of money, right? We want to think about that limitless opportunity. So through that program, there's also a national newsletter that we engage in together where we collaborate, and I've gotten funding through IUPLR as well. And my goal for this, every 2 years, there's a new national headquarters. So this is something that the LRC faced when I first started, where I did have to speak with the dean on decision-making, and that was up for grabs. If you could do a proposal, meet the funding need, our LRC could have become the national headquarters site for IUPLR. But at the time, again, nothing on the dean, but they said, you know, you just started, how about we work on other things? And then I have no leverage and no say on that. Whereas now I can look to potentially in 2 years when this is up for grabs, possibly leading that effort across the country, which then also helps to build a prestige, helps to build more resources, and helps to enhance the credibility of the work that it needs to do within our state. So hopefully that gives you a sense of where I'm seeing this go, but also why context really has mattered for this organization. Because I say I stand on the shoulders of those who've been directors, but I also understand what they had to face and why maybe the things that could have been happening didn't happen. For student achievement, it is primarily tied to our institution by default of where it's located, but we are broadening the work of what we do in other entities because we're tied to so many different resources. And I would say, you know, CBIS is one of those examples where people across the state have already met with us and said, well, when this grant ends, how can we ensure that the program still continues? And what kind of funding can we reach for? What kind of federal funding is there that allows for this to still continue, which then gets at ensuring that there's representation in our health and STEM programs. And I always mention it's beyond representation. It's great if you have 30% Latinos in Nevada and then 30% at our institution, but that's not why we're doing it. We're not doing to equate the population, and we're doing it because we know what happens when you have somebody in that role that's never been in that position, that has this entirely different background and experience that's ever been considered in that group. We're doing it for new ideas. We're doing it to really enhance the thinking. We're doing it for innovation and creativity that has not been considered based on that experience of that person. And to me, that's what matters more than just a simple representation of mirroring a proportion or a demographic or a population. But those events still happen for our campus, and they do speak to representation. At our University of Nevada, Reno, I think it's only roughly 9% of Latinx faculty mirroring Latinx students. So even as that percentage or number approaches the need, we see in HSI Title IX requests, there is hardly reference to focusing on increasing faculty on campus that mirror the need. Serving is great, but it's also very difficult to serve the students when you don't have those like identities on campus. And for our institution, that would be something that I plan to emphasize in our request for funding, that there is intentionality behind recruitment and retention of our faculty. For advocacy and outreach, I mentioned it does no good for the LRC to have a report and then it just is on the website or it's shared on social media. It's all about reaching back to the community and emphasis on serving as a nexus between the community and the university. So earlier this week, we held an event, Workforce and Latino Family Financial Wellness. And that event came about because a year and a half ago, we were asked, do you know how I could help to better my organization? Like, should I hire more bilingual people so that they come into our credit union and create an account? Or should our documents not be in Spanish? Like, how many people need things in Spanish right now? And to what extent do it? And I was like, those are all great questions. I actually don't have a document that shows what the need is locally. And so we launched a report on identifying Latino family financial wellness. And in that report, we ensured that it would have the confidence interval of plus or minus 3% for those of you who do statistics. We really wanted to ensure that it mirrored what the needs are for the community, even if it was just a sample size of roughly 300 individuals. And in identifying that, we got that when they were asked the question, could you afford an unexpected expense? Only 4.5% said that they could. And we know what the statistics are beyond that nationally, but it really was relevant in terms of our community need. And then when we asked them another question that tied back to, when it comes to money management, would you identify yourself as being very confident, somewhat confident, or not at all? And only 12% said very confident. So those types of numbers really gave light to what bankers, credit unions, organizations like that who are seeking us out were seeing. And last week, we had a forum that brought together experts. We had Nevada State Treasurer, this week, Thursday, yeah. Nevada State Treasurer was there. We had someone who has long dealt with mortgage lending, someone else who's a financial wellness investor, and it just brought a lot of people to the table, literally, and we created an opportunity to engage across these different organizations in a way that's really mindful of what we saw happening in the report, and then what we know they can happen in their positions. And then the extension of that is this Thursday, this spring, we're going to do a family financial wellness resource fair, where those people who now looked at the data, had conversations about it, are the change makers, legislators, policymakers of this effort, can now actually be with the community on helping, again, be the nexus between the two. So it's like we planted the seed on Thursday, and now we're going to extend that really in depth later on in the spring. But that happens through all these things. We do have a lot of channels. Thankfully, we have great partnerships with the Latino community, and that's statewide also. In the South, it tends to be Univision, Intravision, and Real Media, others like that. And then in the North, it tends to be all the radios, stations here, Telemundo, Latinos de Nevada. So this is another part. All of them are always mentioning to me, I'm happy to do this. We can do it as like just a PSA and just come over, kind of like do a 3-minute segment with Lotus Radio. I do a 3-minute segment every other Tuesday. I just show up and I talk about the research that we have going on or a need. And they're doing it out of the kindness of their heart. But from my perspective, I'm like, that's great, but the Latino Research Center is not here to also put out an organization. I don't want to go to a business and say, will you donate this, or will you donate your time? I should be compensating you, because we also know what has happened to Latinos and those from underrepresented communities who are constantly being asked without compensation. And that's another reason why, for me, having, for example, a Latino legacy fund is really important, so that when I do go to a radio station or when I do go talk to Juan's not doing it just because we're so giving and we know the importance and value of getting this information out, but it's because he also gets to be compensated in his work, and his work can reward him, because wow, now every so often the Latino Research Center has a plug-in that's actually benefiting his organization too, versus just the reverse. So I'm very mindful of that from a cultural humility perspective, and then just understanding historically that too often this is done on the backs and shoulders of people who aren't being compensated for that really critical work that they're doing. And I do that all the way down to the lens of the advocacy and outreach and these organizations who are so giving. I'll pause there in case there are questions or comments. And yes.
I just want to say, Jafeth, this is so inspiring. You are inspiring. I'm so sorry you're so underfunded. And, definitely we want to find opportunities where we can support what you're doing. But I understand the difficulties of remaining on this campus when you aren't getting that level of support. So we want to keep you here. And so please.
I'm staying here. I say I'm gonna die here. I mean, that's not a good thing from a health perspective.
Well, you know, that being said, when you're asked to take on this level of responsibility without adequate support and adequate funding, we don't want your death to come sooner rather than later. But that is sometimes what happens to individuals. And I know that from experience. So, you know, just really thank you for kind of giving us the lay of the land. I think sometimes we make assumptions. We see a title, the Latino Research Center, and we think that you are well-funded. And so it's sometimes a surprise. And I see that across campus.
Yeah.
I've been having conversations with Dr. Duckworth, and her office is very similarly staffed for something that is supposed to be
So
attending
wide.
to diversity and inclusion across the entire campus. And so I think conversations like this and giving us the knowledge of what's occurring on our own campus is just vital so that we can add our voices and be advocates. And when the time comes to go to the legislature, I hope that you'll invite some of us to be part of that, because every time you succeed, that success supports everyone else that cares about these issues. So thank you so much for what you're doing and for being a positive and providing a spin on this that gives us hope instead of, you know, but at the same time, the reality of the situation is important.
Thank you. Yeah, it is hard for me to share those things because I in no way want to place it as if things haven't happened, because clearly it is where it is now because of the incredible, you know, insight from leadership and their support, but we know it hasn't translated into that full side of it from the resources perspective, from state funding and stuff, which is beyond the capacity of our institution too. Yes, I thank you, and then Dr. Hernandez.
Yeah, I agree that, you know, the work that you're doing is amazing. You're doing the work of 5 people. I think that there's an opportunity there to involve students, undergraduate students. I don't know how many Latino students there are in UNR, but if you create like internships in which they can learn about different things, like let's just say communication, you have students that already know how to, you know, use Instagram and websites and all that, and have them help create that media presence for what you're doing. It does 2 things. It, you know, it enhances your media presence, and also it provides the student with learning experience that can be used in the future. For example, when they apply to a professional school like medical school, they can say, I spent X number of hours doing this support for the Latino Research Center. They might even get interested in doing research. So I think there's ways of expanding your reach by providing an opportunity for students to learn.
And we do have a really strong partnership with Spanish for 100 out of the College of Liberal Arts. So the College of Liberal Arts, when they get to Spanish for 100 class, they're emphasizing the importance of bilingualism, and they're not all from Latino, Hispanic heritage backgrounds. So that also diversifies who's in the Latino Research Center. But it tends to be 4 to 5 students in per semester. So they help with a fact sheet, which is something I just started last spring. They would come in as like, oh, there's Dia de los Muertos, go volunteer or go do this, and it was just very scattered. But now every student who comes in as an intern, they do the city training. So they learn all the ethical context, and then they're tasked with identifying one project that supports the Latino community, and they create a fact sheet. So going forward, every student who's an intern will also have a fact sheet on a certain topic of area, and then it's promoting their own understanding of research. We had one student intern who was doing social media, but it has to be a federal work study, so the time to it isn't as strong in terms of dedication to that understanding. And then I try to really reach out to Noticiero Móvil and KUNR and other organizations that could potentially have interns, because that's the pathway they want to go down officially. But the moment that it's non-paid and it's just for volunteering, they're like, well, we can't do it, because again, we know what our Latino community is facing anyway. So I've tried, we're really trying on that, but I also, again, the compensation piece has still been more prevalent for our students. Yeah, that's a great suggestion. Yes,
So-
Sorry.
Doctora Fernandez, and then we'll go to. Sí.
So just hearing you speak is so, I think it's so inspiring, but it's so also illuminating as to why diversity matters, right? Because, and this happens to me when I meet the pre-med students and the med students who work with me, is that I don't know if it's kind of just our demeanor or like we're so passionate about the work that we take on so much, right? And so when I heard you talk about the retention of med students, I'm like watching you speak and I'm like, oh yeah, like burnout is so high in our community because we want to do so much and sometimes underfunded,
Yes.
usually like underpaid, or you're doing 160% of a job, right? Instead of, and so I'm hearing you speak and I'm like, oh my gosh, we need more people like you in all of the places, but then we also need to keep you in all of
Have it be
the places,
balanced.
right? Because you're so likely to say yes to things
Yeah.
because you care. And so this is probably what happens to med students, is that they get involved in the student run clinic and they're helping their family and they're doing all these things because they care. And then they can't study for the exam, right? Like it's so.
Yeah.
Thank you for all that you do. I was just, the whole time you've been presenting, I'm like, oh, we need just more of you everywhere, right?
Thank you. I'm not here for kudos. That makes me feel super uncomfortable. On the saying yes to things, I have had others who emphasize, well, maybe you're saying yes too much, or learn how to say yes. And I always mention, even from a diversity perspective on that, as a Latina, if we're asked to do 10 things and I'm saying no, I am, but I say yes to 30% of them, that's still 3 things more than the person who's never asked at all, right? They didn't have to even say yes or no. They just didn't get asked. And so that continues that rolling piece of taking on more than what my counterpart might be taking on, from default of identity and diversity and equity and expertise in certain areas. So when people have said, oh, it's too much, you just need to say no more. You're saying yes too much. And I'm like, no, actually, I'm saying no a lot, but it's still the need compared to my counterpart who doesn't have to say no more often. Angel.
Yeah, so I know you haven't gone into obviously everything you've done to try and increase participation, but I'm just wondering if there's a way you guys can take either volunteers. I know I just joined the Latino Alumni Association, so maybe bringing in something like that, or also partnering in terms of what one of the questions was earlier about including undergraduate students, maybe partnering with programs such as TRIO, First Gen, and Honors College to, instead of, paying them, which your program has difficulty doing if they don't have that university grant, maybe offering that like honors college credit and an ability to work with you guys for a semester. Maybe doing that in terms of getting credit and getting compensation elsewhere, instead of just financial contributions.
Yes, we have a really strong partnership with the Honors College and with undergraduate research, because we've also been trying to work on ensuring that when they have if you're unfamiliar with it, they have a discoveries session where the PAC discoveries, they present some research. And so we've been really committed to having that. There's also diversity and inclusion within who's presenting at those sessions. So that's one of the ways where volunteers have been able to help, but I'm always welcome to volunteers. I always share, if you have, just to what you were saying, Doctor, if you say, we help uplift the only organization of its kind in the entire state, and I did all the social media promotion and it went from a reach of like 10,000 to a reach of 100,000, that's huge for your own profession. That's like that's a huge deal. And so same with the research, if you're able to say, I produced X reports in, a 2-year effort for the Latino Research Center, I think that also has a lot of leverage for the person. So yes, we're open to volunteering for anything, whether it's actually an event or whether it's on leading a research project. One of the research projects that I did lead that just came from a student lens, it was Jaime Gonzalez a couple years ago. He said, I'm about to graduate. I didn't know what any of these things existed. I know you just started, but I'm really wanting to make sure that when I leave, students don't go through what I went through. And I was like, well, cool. Tell me what you want to do. He's like, I want to do this event called Latin how, or something that just like brings the students together early on and they talk about what's happening and why it's happening. And I was like, is that just an event or is there a research study tied to this, right? So he ended up he developed his own survey. He asked a bunch of faculty on it. I gave the final look at it. And then he had over 200 students actually respond to the survey because it was so student-led and he was integrated in all his clubs and organizations. And then the event came out, and now the event is still happening. This is going to be the third year this spring that takes place, but I have the data to assess it. Have I published the data? No, because there's a lot of stuff going on. But that would be a great one where for other students, I say, look, I have this data set. Let's get you, city trained. Let's make sure that you're on the study and that you can lead it forward. So there are some things that have been very student-led and others that are very faculty-led. And it's not to be within the restriction of the university. The aim is for it to be statewide and beyond. So when there are opportunities to collaborate across country, then we do, which is one of the grants is with IUPLR. There were other institutions involved in really focusing on what is leading to faculty departures for those who identify as Latinx. Yes.
How about a fact sheet on how the volunteerism and research for LRC would benefit the students?
I think that would be great.
So they would know, like, if I do this, even though I'm not getting paid for it.
Yes.
There is other.
Here are all the benefits.
Right.
I have not done that one, and a student could do that one because it would come from their lens and perspective. Yes, thank you. Tamara.
So I do want to add the perspective of my role as the director of admissions and when we see applicants to medical school, and be really cautious about this movement to put students and volunteers in positions that really should be managed by professionals who are being compensated by this. Because what all too often happens, and I've seen it among our own students, they get involved, they do a scholarly concentration, they're very committed to first generation students, to supporting Latino students, this is where their motivation, their love of community, their desire to make change puts them in positions that takes them away from the academics. And
they crash and burn too.
They crash and burn too. They end up going on leave. They end up needing to step back. They have mental health difficulties because they are so driven by this desire to serve their community. It becomes really difficult to say no, even if it's just to 30% instead of to 100%.
Yeah.
And if you look on the website for the university, what positions are open? Student workers. We're asking our students to lead and to be responsible for things when they should be here learning, being mentored. And yes, it's wonderful to have volunteers, but guess who's responsible for mentoring them, for teaching them, for showing them how to do research in an ethical way? It's the very individuals who are already trying to say no to things so that they can keep their focus. So, from my perspective, what I sometimes see is a pre-med who we want them as physicians, but we end up directing them to a post-bac program because they made judgment calls about where to put their focus as undergrads. And you have those exceptional individuals, and I'm looking at one of them, who find ways to balance many of these things. But not every student can do that. And we're giving them the message that you need to take on more responsibility for your community, which is understandable. But that leads to the retention issues that so concern me, because we put so much of this effort into building first generation programs, providing additional guidance, seeing the need for earlier intervention and support. But I do really want to caution that just collecting volunteers and asking students to uncompensated work or very low paid work that barely allows them, to live, then puts them in a position where they have to make the difficult choice of, do I serve my community or do I focus on getting the preparation I need so that I can move forward? And then at some stage, be that that added representation in our community that we so desperately need.
Thank you. Doctor.
And this is kind of probably dovetail a little bit into the overarching topic of the talk. And thank you for answering a question through that I already had, that I have had probably for a couple of years, that I brought up probably around a year ago, as we were on the path of becoming an HSI and starting to talk about this. When I was in faculty senate, I actually asked the question, okay, so what about faculty? Because we already are stretched very thin.
Yes.
To be able to mentor students, with students up to this day telling me in clinic that I am the first Latino physician that I actually work with. And with us having a growing number of Latino students in our School of Medicine and across campus. And when I asked about, is there going to be any recruitment effort for Latino physicians also, because we definitely need to have C to B, like we have talked with Tamara before.
Yes.
We need to have people who have shared
Experiences
shared
and context.
context to be able to allow for these students to also stay with us, which brings the retention part, to also see themselves in those positions, to want to stay in the community. Okay, and then if you are, I'm a primary care provider nationally. There has been a dip in primary care. Okay, the residency positions for primary care in medicine have actually gone down in number, where a lot of programs ended up going on field, especially in pediatrics. So that means that if you put all of this together, great that we are going for an HSI designation, but if there is no recruitment effort also to be able to retain or to increase the presence of faculty and that can mentor the students, then these students themselves might have a barrier to becoming faculty themselves.
We're just going to continue the cycle that Tamara's mentioned. Yes.
And then the places where it's going to end up getting impacted the most in medicine are likely going to be primary care, which already is having a hard time. So thank you for answering that question.
Yeah.
I brought it up at that time, and it was one of those questions that nobody had a good answer for, and that nobody had any plans at the time. I wasn't aware that the structure of the HSI designation also didn't have an answer for it. I was hoping that it did, but that might be something that we also need to focus as a school, as well, to be able to allow for this designation to be sustainable and for us to better serve our students.
Yeah, it would need to be requested in the funding, because historically the funding always focuses on serving, but it's serving the students, when we know the way to do that is through the faculty. And so, yeah, just really being attentive to the iterative processes is huge. And there are scholars who have looked at all those Title I abstracts to say, this is our Title V abstracts. These are the purposes. And in all of those, it's all student-centered. Very few have focused on that recruitment and retention of their faculty, amplifying that. As you can tell, our outreach continues, as I've been mentioning. It's not this isn't an exhaustive list, but to me, the things that really showed, all right, there's visibility happening, there's growth, there's opportunity, have been when I receive random emails like from Latinos at Tesla, and they're like, how can we collaborate? I'm like, oh my gosh, they know we exist. There's somebody emailing us about this. And so that to me is one of the best compliments of the work of the Latino Research Center, getting out to others from the perspective of conducting research and from the perspective of leading to information and outreach. And to me, all those partnerships help to uplift the Research Center and add to its credibility in the work that it's doing. The biggest one that has recently happened, which is part of why I'm here, is this document, The Ascent Toward Excellence as a Hispanic Serving Institution. This will take you, if you want to, technically savvy peeps, if you want to scan this, it will take you to our website. You see 3 key documents that I mentioned, which is Nevada's Latinas in the Workforce, the Latino Family Financial Wellness, and this report. So I'm showing this report just for visual. The letters and all that will probably be blurry, but I want to just give some insight onto what we see in this content. What I found fascinating in starting this document, which we're in education, we're great at borrowing great ideas. And so UCLA had a report that was on their journey to that. They're much less, they're further away from becoming an HSI than our university is. I think they're at maybe 16%, whereas we already actually hit the number that's required for asking for federal designation this fall. I started this report last fall, so it covers the scope of that effort, but definitely take a look at what is happening. And I think it's evidence that there actually is a lot of work toward serving the students, which can create the wiggle room to ensuring that our focus on our Title V request, when we become a designated HSI institution, can also include faculty recruitment and retention. But this report, what I also found very fascinating is that as I started planting the seed across other institutions and saying, we've got this report coming, it's going to highlight what's happening on our campus, it's going to position us to know how to do the application for federal designation, and then also how to strategize on what we need next when we reach designation. They said, can I get it? We don't have one at our institution. At UNR, they're like, hold on to it, don't release it yet. But to me, it's really important to say that because those institutions already are HSIs. And I'm like, how is it that there isn't a report like this already across the state when we're only one of 2 institutions that remain in seeking that federal designation? So it's really important on showing how far ahead of the game I think that we are, and also just modeling another thing that our research center has been able to attain. I am the co-chair with Vice President Michael Flores on a university HSI task force to really ensure that we seek, get, and move forward with this designation. But this is just kind of, again, another visual. I wanted to ensure that our readers have the content to the essential foundations of not only what the Latino Research Center is or does, but also what having this federal designation will do within our university and outside of our university. One important aspect of understanding the landscape of institutions for who are Hispanic serving institutions is that they encompass approximately 16% of the landscape of higher education institutions, but they serve 65% of the students who identify as Hispanic Latino. So they do have the depth of those students within their institutions. Now, layer on a research very high institution, and a Carnegie R1, which is what our university is. There are only 22 institutions who have R1 and HSI designation in the entire country. So that also positions UNR to really rise to the top of showing excellence and effectiveness and what happens when it occurs through strategy and intention. Really importantly, for this designation, of those who have dual designations for HSI and R1, it has been, scholars have basically critiqued that they have become HSIs by default of what's around their community, that it's never been intentional. But any of you who have long been part of the university know that 10 years ago, the institution announced, we are working toward becoming an HSI. We know this isn't gonna be an easy journey, but we're gonna do this. When President Sandoval was, when he became president, he created videos and did a lot of promotion on saying, I am committed to ensuring our institution becomes an HSI. So there has been a lot more intentionality rather than just a gradual, oh, cool, now we became 25%, now let's do the next step. And it's a very small group of those who do have those dual designations because of either what has kind of happened, or as we know, the term happenstance, whereas for the university, it really is aligned with efforts that have been with design to have this dual designation. But in the paper, you'll see things that talk about serving this. You'll see that within our state, Great Basin College and our college are the only 2 that currently do not have this designation. So I also serve on an NHMA, Nevada System of Higher Education task force that is bringing all these institutions together. This last Hispanic Heritage Month was the first time ever where all institutions collaborated on efforts during a national HSI week, which is led by the HACU, the organization HACU, Hispanic Association of Colleges and Universities. And in that effort, there were a lot of things that happened in the South, a lot of things that happened in the North. We did like social media hashtags together on HSI Week, promoting HSI, having talks that were both virtual and in person. And it was all a collaborative piece that really, think of the power that will come when every institution in the state is actually a Hispanic serving institution, and what that does for servingness and opportunities for others. This is what the layout looked like in the last nearly decade of those at the University of Nevada, Reno specifically. So last fall, we were super close to reaching that designation, but it just wasn't quite there. And it's a question that I asked our leaders was there ever a campaign to declare your identity? Because if we had maybe, I don't know, 10 more, I don't know the numbers, right? But what if there were only 10 more that simply didn't declare what their identity was? And we would have already hit that marking point later on, which the marking point is important because it's a requirement, but that's not the point. The point is then actually serving the community and the students. And right now, as you know, for this current fall, we have hit that designation, but we need to make sure that we sustain it and that we look at other pieces. Now, from the medical perspective, to me, this is a really valuable graphic on showing what has happened in terms of funding. And then also, I just squeezed that one in together when we look at the comparison for out-of-state and in-state. We know legislatively there was an effort to ensure that those who are DACA and others considered out of state, that they actually get in-state tuition, which had not been the case either, which is really essential for that pathway into other programs and careers. But from the medical, to me, what's interesting when you compare grants versus scholarships, how there's almost been a shift of more reliance on scholarships than grants, but we don't see that in the undergraduate. And to me, I'm tying that into FAFSA because that is being included in here, but you can see that there's still reliance on, when we look at the undergraduate, that light blue, that's all primarily grants, which is also linking in FAFSA. So it also gives us a scope of what our students are doing in order to ensure that they're thriving in the community from a financial perspective. And then we look at the difference there either way for that doctoral professional area for the medical field, which is significant. I do have a different one in the report that speaks to how the prices have changed over time year by year and what funding is in the medical area. So be sure to look at that one because you do see some dips in the medical field, the support that they're getting, which is actually lower or less funding compared to previous years. I just don't have how many students were there to demonstrate whether the proportionality stayed for student to actual access to support financially. And then total enrollment in general, this gives you a scope of how that's changed, both at the undergraduate, the graduate, and then the medical level, just because we do see some influx in there. The University of Nevada, Reno's enrollment was actually one of the few who, even during the pandemic, they didn't see as extensive of a dip in enrollment as compared to other institutions and as compared to nationally. So there's still great things happening. We just want to make sure that that is happening also with the relative and clear need for funding. I pitched this. This is a little shameless plug. We do have a QR code if anybody wants to help promote that. Anybody can donate even just $5. It will make a difference when you know what the access to needs are for our institution. This, when I mentioned about compliments and really seeing the growth, this last semester, I received an email completely random. It just said, "Hi, I'm with Corwin Buick, and we look at philanthropy, and every year we choose 2 organizations that we've been keeping an eye on, and we would like to recognize you at the Vamos Pack, which is Hispanic Heritage Month football game. We'd like to recognize your organization and provide $15,000. And I wrote to them, you know, $15,000, you just gave me a 300% increase in my operation funding. So it really does go a long way with those who are able to contribute. We also got approval at our campus for a local murist, Edwin Martinez Escobar. If you have seen the Latino Research Center through the entrance of the back part of the campus, it's a direct entrance into our organization. It's a 3-wall section, and we're going to have a mural on there. It's going to be the first time our campus has visual representation of the Latino community. It's intended to have statewide contributions of what that looks like. And that is a $25,000 estimate, which I've been writing grants to get access to funding, but we're really close to meeting that designation. If you have networks that would be willing to help support that, please, I encourage you to share our QR code in our campaign, and it's on our website and other places. But here's some other areas to find us, what we're doing, and I am accessible because you know I'm the only person. So feel free to email me. I will respond to you, and I am very committed to doing that quickly. So thank you all for your time. Seguiremos adelante.